say that most illness is caused by inflammation?
Pretty much all illness stems from initial inflammation, yes.
So, for example, anything that ends in itis?
Yeah, anything itis is just the translation of inflammation. That's what it means.
So arthritis, colitis, cystitis, all of those things.
All those things are inflammation.
Is this a relatively new point of view?
I think it's being increasingly recognized. It's always been recognized, but enough of it to get the same effect, and you don't get the side effects.
How does it work in terms of cancer treatment?
Well, with cancer treatment, what happens is that serrapeptase gets rid of a lot of the protection that the cancer cell has against treatments. So it basically cleaves off the protective layer that the cancer cell has, and that allows any kind of treatment to get in and kill the cancer cell a lot better. So both conventional and non-conventional cancer treatments.
Why is it important that it digests protein?
Well,
in particular,
because most of the toxic.
So, how would using a product like serrapeptase, an enzyme, how would that help conditions like arthritis or colitis or any of those itises?
Well, all of those conditions, as part of inflammation, there are a lot of chemicals, and there's a lot of debris, and there's a lot of toxic compounds that are formed. And
as a result of inflammation?
Yeah, as a result of inflammation. So when you have an enzyme like that, what it does, well, if you can do that, then you basically will open up the arteries, you will improve circulation, you'll get more oxygen to the tissues, and tissues will have a chance to heal. And that's basically the way the enzymes work.
How is it used can you also use serrapeptase or this particular enzyme for digestion, for improving digestion?
Yes, you can.
Pues es de la serrapeptasa, que es una enzima que me gusta mucho y quiero hablar de sus propiedades porque va muy bien pues para tratar muchos problemas como quistes, problemas respiratorios también, problemas circulatorios. Y bueno, pues contaros un poco la historia, ¿no? Que es una enzima que realmente es producida por una bacteria, la Serratia especia, la enzima que les ayuda pues eso, a disolverlas más rápidos, ¿no? Este estudio en 1969 pues fueron investigadores alemanes que realizaron un Scientific Medicine, una revista alemana, y bueno, para el que lo quiera consultar. Y luego hay otro estudio interesante que se realizó en mujeres que tenían quistes en los senos, y bueno, pues apreció una acción favorable de la serrapeptasa, disminuyendo sobre todo la inflamación, sobre el exceso de fibrina y de tromina en los sanguíneos. Entonces aquellas personas que tengan, pues ayuda a disminuir la viscosidad de la sangre, ¿no? Aquellas personas que tengan tendencia a la formación de trombos, así como la formación de placas de trombos, pues les puede venir muy bien, ¿vale? Y también, por supuesto,
anything that lives is built by enzymes, which are living proteins, and there's three real types of enzyme. One is an enzyme that digests the food that we eat. The second one is an enzyme that takes that digested food and rebuilds the body and makes it healthy. And the third one is an enzyme that cleans up the mess after all the work is done. Of course, the work is never really finished, but this last enzyme is what serrapeptase is. It's a clean-up enzyme. It cleans up inflammation and inflamed dead tissue in the body so that it doesn't build up, because of course if it builds up, then of course that causes a disease problem. That's what we do. Some doctors in Germany have prescribed it for over 25 years, doctors in Japan have prescribed it for over 25 years, some doctors in America prescribe it, some doctors in the UK prescribe it, but not many, because the doctors are very, very highly controlled in the USA and the UK, and the control of course comes from the drug industry because they want doctors to prescribe drugs. The patented drugs, they make high profits on it, and they certainly don't want them to prescribe something that's going to clear up the problem and the person's going to get healthy, because then they're not going to sell many drugs. So that's what says don't prescribe it in the name. I'm taking medication, can I use serrapeptase? The answer is yes. There is no interaction with any drugs you can be taking. You can take it with any drug, I don't care what the name of it is. Serrapeptase whilst pregnant. Yes, you can. You can take it before you're pregnant. Many women use it for clearing blocked fallopian tubes. You can take it during pregnancy for all the aches and pains that you're likely to suffer. And you can take it after the birth In fact, many women use it when they get breast engorgement, when they're breastfeeding and they need to go on antibiotics. They use it very quickly, 2 or 3 tablets of serrapeptase, and within an hour or so the engorgement's gone and they're back to breastfeeding their child successfully. So you can use it at all stages of pregnancy. I answered this question before, does it thin the blood? This is 2 questions in one, but let's cover both of them. There's no side effects with serrapeptase. In fact, I've been involved with it for nearly 10 years now. I first introduced it to the world with my books and newsletters around about 2000 it was. And really there are no side effects with it.